Unborn children are fighting for their lives. Welcome to Freedom Alive. It's a tragic time in history when voters are given the option whether or not to kill unborn babies. But that's where we are. Dr. William Lile is board certified in obstetrics and gynecology in Pensacola, Florida. He's known as the pro-life doc. Dr. Lile not only delivers babies, but he is an avid fighter for their lives. We're honored that Dr. Lile joins us on this episode to discuss why abortion should never be an option. I'm blessed to again be joined by our co-host Matt Staver from Liberty Counsel. And Matt, even though pro-abortionists say otherwise, every preborn child is created in the image of God and deserves the right to live.
Yeah, from the moment of conception, from fertilization, that baby now has a unique DNA that's separate from the mother. And the only distinction between that moment, which actually is accompanied by a flash of light, we now know, amazingly so, that life actually begets this light at the moment of fertilization. So it is amazing what we're seeing happening with the deception with respect to abortion, because groups like Planned Parenthood and others, they don't want you to know exactly the truth of what takes place in abortion. This is just the most horrible thing that you can imagine, and we need to respect the sanctity of human life, especially among the most vulnerable.
Absolutely. You're right about the deception. It's unbelievable. This is a very timely and very true story, and we cannot wait to bring it to you. But our Freedom Alert is next.
The dark reality of abortion in America. Despite what pro-abortionists want people to believe, the truth is children are being murdered before and after their birth in America. Data from just 9 states alone show that 277 babies were born alive after a failed abortion since 2006, and in some cases left to die. Mainstream media has been quick to deny the reality of what's happening to innocent children. The truth is abortion is in the 9 months occurring, and it is legal in 21 states, and 15 states do not actively prevent infanticide. The deliberate strategy to cover up this horrible fact is shameful. Late-term abortion up to birth and infanticide cannot be ignored and must be stopped. Make sure you know the truth about abortion. We must protect our children, whether in the womb or already born.
Up next, Matt's interview with Dr. William Lile.
I'm pleased to welcome to Freedom Alive our very special friend and guest, Dr. William Lile. Dr. Lile is board certified in obstetrics and gynecology with an active practice in Pensacola, Florida. And oftentimes, Dr. Lile, people call you the pro-life doc. You deliver actually up to 30 babies a month. That's quite amazing. That's almost one a day. So welcome to Freedom Alive, Dr. Lile.
Well, thank you much. It's an honor to be here, and I love what I do. It's the only time when people are happy to go to the hospital.
That's right. Well, you have a website called prolifedoc.org. That's prolifedoc.org, and I encourage people to go there for your information and your expertise. Let me talk a little bit about the issue of abortion, and let's talk first about what actually happens in the womb. Because in order to really understand abortion, for me anyway, I really understood it when I found out what was actually taking place in the womb. And move away from some of this rhetoric of choice or women's rights to find out what actually is happening in the womb. And there's a lot of amazing things that I think people are unaware of. For example, there are now life-saving blood transfusions that are actually taking place on the baby in the womb. Address some of these issues, these miraculous interventions that are happening already in the womb.
Well, first, the baby at that moment of conception is genetically unique from the mom, genetically unique from the dad, genetically unique from the other 8 billion people. And this is one of my patients. When it comes to blood transfusions, the question is, well, first, why are you doing a blood transfusion? Because from that moment of conception, not only are the babies genetically different, and half the time it's going to be a little boy where all of the cells are unique from the mom, but sometimes babies and moms can have different blood types. And in some situations, moms can develop antibodies, which can cross the placenta and actually start to attack the baby's blood. The baby's blood count will drop, so we can sometimes either deliver the baby, or what do we do if the baby's only 18 weeks along and cannot survive on the outside at the best NICU? We actually can give the babies life-saving blood transfusions. We do that with donated blood. If you donated blood, the Red Cross or One Blood, we can take your O-negative blood, place it in a syringe, guide a needle through the skin of the mom, through the wall of the uterus, go right up to the umbilical vein, and give that baby a life-saving blood transfusion, bring that baby's blood count up. Just as if you went to an emergency room and you were anemic, we can save the lives of a person in the emergency room, and we can save the lives of babies in the womb.
Unbelievable. And there's also now even laser surgery that's taking place. And you have a video of laser surgery for twins in the womb. Talk about that.
When it comes to twins, it's always exciting. Everybody's happy, but for the OB, there's twice as much to follow. And sometimes, sometimes twins don't get along real well on the inside. And sometimes when twins are sharing one placenta, remember the movie Twins with Arnold Schwarzenegger, where he was huge and Danny DeVito was really tiny? Well, it happens in twins in the womb when they are sharing one placenta, where one baby will be taking the majority of the nutrition and the other identical twin is kind of getting just the leftovers. So when we see this condition and it's severe enough, we send our patients down to Texas Children's Hospital in Houston. They will evaluate the babies. They will then go inside of the womb of the mother with a fetoscope, a scope just like if we would take a gallbladder out. They go into the womb, they see baby big, baby small, and they map out the placenta. And they will actually take a laser, just like Luke Skywalker with a lightsaber. They'll take that laser and they will carefully start at one end of the placenta, and they will go spot by spot. And literally they are dividing the placenta in two, saying this is your side of the placenta, this is your side of the placenta. They will watch them for 10 days in Texas. They will then fly the mom and the twins back to us in Pensacola. We will follow them for the rest of the pregnancy, and where we might have sent them down at the 90th percentile and maybe the first percentile, by the time we deliver them, they are maybe 70, 30, 60, 40. So if we can teach identical twins how to share in the womb, then they are patients, and patients have rights.
You know, the interesting thing is I saw a documentary some years ago. It was on a secular station, and it was about twins in the womb. And you don't really think about it. I'm sure you do, but the common person doesn't think about it. The personalities that they have outside of the womb, whether one's dominant, one's passive, it actually begins inside the womb, exactly how you're talking about.
Exactly. Even when moms only have one baby on the inside, if they say, oh, I can't wait to deliver this baby because this baby is up from 1 a.m. to 5 a.m. Well, kids have a personality, and every mom who's had more than one baby knows that the personality inside is going to match the personality on the outside. And if they are wide awake from 1 a.m. to 4 a.m. on the inside, they're going to be wide awake in the same way on the outside. So just delivering the baby doesn't change that.
And we have even brain surgery that is taking place on babies in the womb as well.
Exactly. There's a condition called a Galen malformation. With a Galen malformation, there's an abnormal connection between a high-pressure artery in the baby's brain and a low-pressure vein. And the vein is getting dilated, and actually can rupture. Babies can go into heart failure. So it used to be that we would have to wait until after the baby was born to do a vascular surgery in the baby's brain. But doctors up at Boston Children's Hospital recently did this procedure on the inside of the womb. Half of these babies, when we diagnose them with this condition, will get really sick. And of the babies that get sick, half of them will die. So when we diagnose this, 1/4 of these babies will die almost immediately after the delivery. So the doctors took a needle and under ultrasound guidance passed it through the skin of the mom, passed it through the wall of the uterus, so now it's in the fluid around the baby. They actually went into the back of the baby's skull, into the brain. They went to that abnormal connection between the artery and the vein, and they put the needle right into that abnormal connection. They added vascular coils. These coils, first it was 1 coil, 2 coil, 3 coils, and they actually were able to block that abnormal connection. Dr. Sanjay Gupta from CNN, which isn't the Christian news network, just regular CNN, Dr. Gupta actually did a report on this. And what's amazing is when he described, and he's a neurosurgeon, he said when it comes to fetal surgery, we take 2 patients to the operating room instead of just 1. Even Sanjay Gupta agrees that with the mom is clearly a patient, but the baby is a patient as well. And Florida and all the other states have amazing rights for all patients.
Now, how do you get the baby, just like, if you're operating on somebody's brain, you got to keep them anesthetized. How do you keep the baby still during that surgery?
Well, we can actually give babies a medication called Norcuron. Norcuron is a paralytic that will keep the baby from moving. The heart still keeps beating, but the baby doesn't move. We can also give a little bit of local anesthesia to the area on the baby's skull before the needle goes in, just a little bit of lidocaine. But amazingly, as complex as our brains are, there are no pain fibers when it comes to the brain. So when adults are having brain surgery, often the adults can be wide awake and can tell you what they are sensing while they are doing the brain surgery. So, but with heart surgery, we actually have anesthesiologists specifically for the baby.
And in fact, you have heart surgery. You've got a video here of a heart surgery that's taking place on a baby 26 weeks in gestation.
Correct. The baby was diagnosed with a cardiac teratoma. This is a tumor that was growing right on the surface of the heart. It was growing so quickly that they said this baby will die in 1 to 2 weeks. The mom had an epidural, so she is completely comfortable, but mom is wide awake. They had 36 doctors, nurses, anesthesiologists, and techs. The OB made an incision in the mom's skin. Then the OB made an incision in the uterus. They brought out the right hand. They brought out the left hand. Then they brought in a pediatric anesthesiologist who started an IV in the baby's hand. Then the cardiothoracic team came in, made an incision in the baby's chest, opened the baby's chest, removed this tumor from the baby's heart. Almost immediately, the baby's heart started to pump normally, saying, thank you for getting rid of that tumor.
Amazing.
They then closed the baby's chest, removed the IV, tucked the baby's hands back in. That was at 27 weeks gestation. The baby recovered and healed for 10 weeks. They didn't deliver that baby until 37 weeks gestation.
Unbelievable.
The baby's doing great, and the baby almost has no scarring on the baby's chest because the baby was still growing and developing while the baby, had just had open heart surgery.
Well, you also have an SVT corrected in the utero. That's like a supraventricular tachycardia, heart condition?
You nailed it. Absolutely brilliant. Supraventricular tachycardia is when the heart is beating about twice the speed of normal. We have this condition in adults, and one of the ways that we correct it is we give the patient an injection of something called adenosine. Adenosine is like when your phone isn't working well, and my wife will tell me, just turn it off and turn it on again. We can actually do that with the heart. Adenosine works very quickly, but it only lasts for about 5 seconds, and it will stop the heart, and it really allows it to reset. We are now doing SVT correction with this medicine adenosine with babies on the inside, where babies might have a heart rate of 240, 250, and they will die. They will go into heart failure. So we take this medicine, adenosine, we place it in a syringe, we guide the needle right through the skin of the mom, right through the wall of the uterus, and we go directly into the umbilical vein, and we inject this medicine, which goes immediately to the baby's heart, and it will stop that baby's heart. For about 5 seconds, the baby's heart is stopped, it repolarizes, resets, and when it comes back to beating 5 seconds later, usually it's at a normal rate, and we just saved that baby's life by injecting that baby right into its own blood system with a medicine that stopped the heart, reset the heart, and that baby's going to do great.
Now, Dr. Lile, I mean, we could go on and on about this amazing development of science of being able to operate and treat the baby inside the womb. And the more we learn about it, the more it's inevitable and it's obvious that this is, as you say, a second patient, a human being from the moment of conception, uniquely different from every other person on the planet. With that said, unfortunately, there is abortion that takes the lives of these unborn children. And you have done some simulation about what it would look like, and you've done some modeling like that. And I want to look at your first trimester abortion machine demonstration. Tell us about that while people watch that simulation as you speak.
Well, the practice that we took over in 1999 was one of the largest abortion clinics here in Pensacola. We took over the practice, had him sign a non-compete. He couldn't practice for 2 years, and we inherited all of his abortion machines and equipment. And what you'll see on a first trimester abortion is demonstrating the power of the suction machine, where the suction machine, we demonstrate it not with blood and baby parts, but we actually place the suction curette, which is what goes inside of the womb. We place that inside of a steel paint thinner can. And this is a can that I can stand on and it will not collapse. But when we place the suction curette inside of the lid of this machine and then turn the machine on, then you will see this steel can just collapse from that force. So when they used to say, it's just a blob of tissue, it's not a baby. Well, it's like ground beef doesn't look like a cow, because when it's gone through that much force, then what you see in the suction container is just, been macerated by this machine. But then we also demonstrate without blood or baby parts how a second trimester abortion is done and how a third trimester abortion is done. Yeah,
and let's look at the second trimester, because the first trimester abortion is what actually changed my whole thinking on this back in 1983 when I watched the documentary called Assignment Life. And I saw on that documentary a real-time first trimester suction abortion, exactly what you're talking about. But this, unfortunately, was with a real baby. Yeah. And that baby was sucked into this canister, and then the body parts were taken out of that canister and then reassembled on the table so that they could determine whether they got all of the baby body parts. They didn't want to leave anything, obviously, inside for infection purposes. And when you
Correct.
saw that, it was shocking. And when I saw that, that's when I realized the facade of choice and all that, that's just rhetoric. It's Orwellian language. This is really a human life. So you also demonstrate a second trimester abortion. Tell us about that.
Second trimester abortion, the baby is too far developed to just be able to be sucked through a tubing. So what they will actually do is they need to remove the baby piece by piece, where they'll have graspers, which will go in through the cervix. They might grab a foot, they might grab a leg, the abdomen, the chest, the head, and they will literally piece by piece bring out this baby. And a lot of times this baby was alive and had a heartbeat moving around on the inside, and they will abort that baby in the second trimester with this procedure. It's actually horrible. And there's actually a fellowship now which is training people on how to do second and third trimester. It's called Complex Family Planning. Oh. It's one of the fastest growing fellowships in obstetrics and gynecology, because they anticipate there will be a higher demand for people who've been trained in second and third trimester. So after 12 years of learning how to have a healthy mom and a healthy baby, you spend 2 more years on how to not only abort later term abortions, but even to perform a procedure called a selective reduction, where if a mom is blessed with triplets or quadruplets, they will teach you how to abort and inject medication called potassium chloride directly into maybe one baby's heart, 2 babies' hearts, to decrease the numbers of babies. I mean, it's like Sophie's Choice. How do you choose which baby you're going to abort? And I've delivered triplets and I've delivered quadruplets, and they have done fine. But that is the second trimester abortion.
And a third trimester abortion, you've got some demonstration example of that as well.
Yeah, with a third trimester abortion, what's crazy is that if the baby's head comes out, there actually are a lot of states that have laws that will protect that baby. In other states, then you don't have that protection. But with a third trimester abortion, what they'll usually do is they'll place instruments through the cervix, they'll dilate and stretch the cervix, and then with the instruments, they will try to grab the baby's feet. They will then deliver the first foot in the leg, the second foot in the leg. Then they'll guide the baby's abdomen down out from the vagina. Then they'll guide first the right arm and hand, the left arm and hand. And now the baby is completely out of the uterus. The only thing that is still inside the mother is the baby's head, and that is there inside of the vagina. And the baby is moving around often, and they're on the outside, but the head is on the inside of the vagina. They'll then take an instrument, and they will take a pair of scissors, go right through the base of the skull, right up through what's called the foramen magnum, which is the opening from the base of the skull up into the brain, and they'll open that area going from the back of the baby's skull, and then they can place that same suction curette, that catheter, which sucked out the baby on the first trimester, and now they can kill the baby from the outside, and once the baby is dead, then they'll deliver the baby's head as well. This is a baby that would do well in our NICU, would do well on the outside, and it's just tragic that somebody can spend their lives learning how to have healthy moms and healthy babies, and then take those hands and those skills and use them to take life.
You know, that's hard to imagine, Dr. Lile, because you're trained to help the mother and help the child in the womb. You're an obstetrician and gynecologist. That's what you do. You do high-risk pregnancies. You save the babies. How can someone transfer that life-saving skill that they've been trained to do to now go to the same location with the same baby and say, now you're not going to live, you're going to die. Not only that, you're going to die in a very brutal fashion. I just can't understand that.
That's why we have to realize this is not a battle of choice. This is a spiritual battle we are engaged in. You remember in Proverbs when it says there are 6 things the Lord hates. It was a haughty eye, a lying tongue, and the third thing was hands that shed innocent blood. I can't think of anything that defines hands that shed innocent blood, but talented, skilled, well-trained hands which are shedding blood and taking the lives of the babies in the womb. It's a spiritual battle. It's just like in Judges 3, 4, 5, and 6, where the children of Israel were loved by God, but it says the children of Israel did evil in the sight of the Lord. They were worshiping idols. They were worshiping other gods. But one of the things they were also doing was child sacrifice, offering child sacrifice. And God didn't just say, hey, y'all are on your own. He actually strengthened their enemies. He delivered them into the hand of the enemies. And that's where we stand now. 64 million babies is doing evil in the sight of the Lord.
I want to return to something that you mentioned. We talked about the amazing development of the baby in the womb. We talked about the first, second, and third trimester. But also, I want you to talk briefly in the closing moments about the abortion pill, because you've been very successful, and others, at reversing some of the effects of the abortion pill if someone changes their mind and you find out in time. Tell us about the abortion pill and what's happening about how you can stop the progression of that abortion pill once someone takes it and changes their mind.
Sure. The abortion pill is now the most common form of abortion here in the United States. 63% of all the abortions up to 10 weeks gestation are performed with the abortion pill. It's 98% effective. How does it work? It works by blocking a hormone called progesterone. And then the second day, you take medication called Cytotec. Cytotec causes contraction. So the first pill will take the life of the baby, and the second pill will cause you to have contraction. So can we reverse the effect of some medication? Sure. We had over 112,000 people die in the United States from narcotic overdoses last year. We had almost 8,000 people die of narcotic overdoses here in Florida. Everybody who makes a bad decision on taking narcotics such as fentanyl does not die because we have Narcan. Narcan is with all the cops. It's in our airports. It's in our schools. It's in our churches. You can go on Amazon.com and order Narcan, and it'll be at your house in 2 days. It is the antidote and reverses the effect of a narcotic. Well, we have the same antidote when it comes to the abortion pill. The abortion pill blocks progesterone, and progesterone levels drop. So what do? We just give the mom progesterone. It just makes sense. Progesterone that we use in normal obstetrics all the time. I'd say 20% of our patients on our high-risk OB floor are on progesterone. It's made from yams and soybeans, and it is bioidentical, exactly the same as what the mom produces in her own body. So we are successful. I've attempted doing this 19 times since the last 5 years. We've been successful 15 out of those 19 times, where a baby had a 98% chance of dying, but then I get the chance to deliver these babies. Wow. But we have a network of 500 doctors nationwide that we've trained. We have a network of nurses up in Columbus, Ohio, which man our hotline and will match a patient with a doctor who can help them out. And it is amazing ministry. But we have over 1 million abortions in the United States each year, and over 600,000 of them are with the abortion pill. And sure, we celebrate the 5,000 babies' lives that we've saved, but that's just a drop in the bucket. But we all make mistakes. We all say things that we regret and do things that we regret. And we have a lot of moms who take the abortion pill because they are scared. They don't feel anybody's there to help them out. And then they have immediate regrets. And we're there to help them safely reverse the effect of the abortion pill.
Well, Dr. Lile, you have presented some incredible information, and I just want to encourage you to continue in your life-saving work. I know you don't need me to encourage you. The Lord is your encouragement and your guide, but just know that so many people are praying for you, very thankful for your practice, for your very clear message. And for those that want to follow you, get more information about you, and perhaps maybe even make contact. They know somebody who's taken one of these abortion pills, and they want to reverse that awful decision that they've made. They can go to prolifedoc.org. That's prolifedoc.org. Dr. Lile, thank you for joining us on Freedom Alive. It is always a pleasure.
It's an honor, Matt, and God bless you, and thank you for defending the lives of God's preborn in the womb.
Thank you. Good to be with you.
Matt, another episode that showcases the remarkable ways that God works using, in this case, people like Dr. Lile and the technology, the way that he works to save babies in the womb, all of these things that have happened, yet so many still buy this lie of abortion that Satan continues to deliver through his people.
Yeah, you know, when you think about it, when you think about something that just seems illogical and against rational reason, and it still happens, the only thing I can say is that it's a spiritual blindness.
With all of these remarkable advancements and doctors like Dr. Lile, could it be any more clear that God loves his kids? He loves life, and he hates these actions of murdering his kids. In closing, remember Proverbs 12, verse 12, which says, "The wicked desire the stronghold of evildoers, but the root of the righteous endures." Our freedom is a gift from our Creator. We must never forget that and always protect it. So join us here next time, where you'll hear victories as well as ways you can stand up for your priceless freedom. Join us again for Freedom Alive.